My name is Aranza Sanchez Cruz. I'm the Innovation Manager on the Research and Development team at HealthLeads, and I was also the lead facilitator and one of the co-designers for the residency itself.
I am Ebony Cobb, and I am the Manager of Software Development on the R&D team.
My name is Elspeth Sykes. I'm Manager of Analytics on the Research and Development team at HealthLeads.
Usually what happens, this happened for the residents too, but it happens even within our team, is that we'll feel a knot of like, oh, we think there's an opportunity here. We think that we're hearing something from our community partners, or we're experiencing something within our work or our own lives. And we feel like there's an opportunity here to innovate in a way that could be potentially paradigm shifting or sector changing.
My name is Dozie O'Harry, and I am the founder and CEO for Choose to Do Inc.
My name is Lourdes Zúñiga, and I am the Executive Director and Founder at the Financial Health Pathways.
My name is Luis Enrique Bazán. People know me as Quique. I work for an organization called Ayudando Latinos a Soñar, ALAS.
We specifically are working with people and organizations that are deeply equity-minded, who are not afraid to speak about racial equity and racial inequity in their community, and are dedicated to their concept addressing racial inequity in whatever way they see fit.
The design of our residency, we were thinking about what if there would be some way for grants and funding structures to give you the time, space, and resources to try something new. And one of the things that was really important to me about the design of this residency is that it minimizes the risk of innovation, because innovation inherently, it means you're trying something that doesn't exist. And so you can't prove or 100% predict what's going to happen. And so it takes away some of the risk of doing that, because we're developing a really, really mindful and well thought out, well-researched prototype and then testing it. So you get to know in a very small and low risk environment, to get to know if this idea, this dream, this innovation that you have, if it's going to have the impact that you think it will.
The bigger these issues are, the more time we need to build that strategy to tackle them. And when you don't have time, oftentimes that kind of prevents you from innovating. And one of the values of the organization is innovation and collaboration. But to do that, you need a lot of time. So I think that the Maker's Residency, what has given me is the discipline to have that time, to look for that time, and to sort out those issues and address the issues that we wanted to address, and not just to provide Band-Aid services that are helping in some way, but really aren't addressing the root cause of the problems and the poverty that we're experiencing in this region. And I think that that is worth taking the steps to make that time.
We were working with Maker's Residency about creating a research center. And the issue is that we have a lot of people that come, a lot of researchers, academics that come to the organization, get the data and bring the data to the universities, but doesn't necessarily stays within the organization and within the community.
And I think that there was a bit of a turning point during the ideation session, where the bases of knowledge that Kike and Sandra wanted to pull from kind of broadened as a result of suggestions and ideas provided by fellow makers.
But we want to be more intentional about what are the needs of the community, and being in the best interest of the community more than in the best interest of a degree. And it's because we do have that responsibility with our people. And that's where we started thinking together about what it will look like. And the process has been amazing. It has been a really good process. I felt in company, and also the innovation elements of how to remove us from where we are comfortable and put us in new situations to be creative and to hear the feedback of people that are also coming from other communities with different perspectives, really stretch out our imagination in where we should put our efforts, our thoughts.
I found it very valuable to have to like reframe and rephrase certain things and actually explain different parts of the process more thoroughly, because that like reinforced my understanding, reinforced my comfort talking about it and being able to support. So it's kind of like the teacher benefit.
The vision was to make a change, to see a change within the communities of Houston that have low literacy rates. So the vision is to see the literacy rates rise within the different schools and communities and programs that are out there.
And so this is a way for us to gain support, to build a network, to help us build out, help us to put a focus on building out our concept.
Lourdes had already done so much work within her community. She did all this research that had on financial health in the state of Texas and the city of Austin that like has never been done before. Like she did all these things and also mostly by herself, which is insane. I think it made our visioning for this concept so much bigger. And I was surprised by that, and also a little bit, at first a little bit reserved about how big it would be. But then I think we both realized that we could really do it.
So throughout the process and the ideation and the prototype, we came with a very interesting concept that is hitting all the boxes of the things that the research said that we have an opportunity to do. And I am very grateful for Aranza's, my coach, input and how she captured everything that I said and put it into an action plan that actually speaks a lot on the need that we have here in our region, but also on the vision for the organization and the ecosystem itself.
When we found that we had this opportunity to do some pass-through funding, we were being really mindful of like, this needs to be unrestricted funds. The makers do whatever they want. We trust them because they're doing what they need to do for their community. They already are really impactful. There are so many community organizers and small nonprofits and community-based organizations that do essential things for their community